If you're an owner of an IV hydration, aesthetics, or health clinic, you may have realized that offering Botox treatments is an easy way to bring a ton of value to your clients and bring you a significant revenue stream with very little overhead. In this video, we'll talk about what Botox is, what it's used for, and the most common applications. If you or your clients are thinking about exploring what Botox treatments can do, then you're in the right place. Hi, I'm Jason Seitz, paramedic, nurse, and director of education. Welcome to Guardian MD. If you find these videos helpful and you want to see more, please take a quick second to like and subscribe. It goes a long way in helping us continue to offer free education. Botox is a popular and prevalent aesthetic and medical treatment that's often misunderstood. While your first thought may be celebrities that have overused the treatment and now look emotionless or frozen, rest assured that with proper and safe use, Botox can be administered to improve people's self-image, allowing them to live happier and healthier lives. What you may not know is that Botox isn't just used to smooth wrinkles, but for many years has existed as a medical treatment for neck and muscle spasms, bladder problems, migraines, lazy eye, and even excessive sweating. Botox has been used to change the lives of people suffering from all of these and more. Before we get too deep into how you can start using Botox to help your clients, let's cover some basics. Be mindful of the risks of any medical treatment, and ensure the procedure includes consent, information on risks, that your clinician carries adequate training on the procedure, and that they have the adequate medical oversight in the form of a medical director or physician collaborator to be running a legal, compliant practice. Medical directors and physician collaborators are licensed doctors that oversee non-physician providers to ensure a medical practice is appropriately run. Without medical direction, non-physician run practices are illegal and potentially dangerous. If you want help in finding a medical director or physician collaborator for your clinic, Guardian MD can help by ensuring the care you deliver or receive is compliant and safe. Check out guardianmd.com for more info on our mission to ensure that every provider can have a practice. So what is Botox? Botox is actually a brand name for Botulism Toxin A. Now don't freak out, just because we're using a toxin doesn't mean that it's toxic to our body or will harm us over time. Yes, Botulism Toxin A is a neurotoxin. In fact, it's one of the most poisonous biological substances in the world. But let's talk about what that means. A toxin is a poison or venom of plant or animal origin, in this case produced by a bacterium, and poisons are substances that are harmful to our body. But what do we consider to be harmful? In the case of botulism toxin A, it interferes with normal neurotransmission to muscle tissue, temporarily paralyzing it and not allowing it to contract. Now, is that harmful? Well, certainly if it's the muscles I'm using to breathe, but certainly not if I'm using it to prevent harmful muscle spasm, reduce pain from muscle contraction, or smooth the wrinkles in my forehead. In the case of Botox administration, we can use the interfering effects of the toxin to treat truly harmful conditions. We do this in medicine all the time. For instance, receptor blockers that prevent your body's ability to bind with naturally occurring chemicals that cause a fast heart rate or respiratory depression. While these medications are acting against the body's function, it doesn't mean that they're harming our body. Quite the contrary. How we use Botox is very similar, and you can rest easy knowing it's been approved for decades by the FDA as a safe medication for many uses. We'll cover lots of ways Botox can help clients with various medical conditions, but we'll start with its most common use, the aesthetic removal and prevention of wrinkles. Because Botox temporarily paralyzes muscle tissues, it's most frequently injected into areas of the face to freeze facial muscles and prevent wrinkle lines. Now, this is different from filling wrinkles. That would require filler injections to replace fat and collagen that's lost over time. This differs in that it simply prevents your face from being able to make the movements that would cause wrinkles, and over time causes the wrinkles to smooth out and create a youthful appearance. Botox treatments can last for around 3 months before the effects wear off, and with subsequent treatments can continue to hold the face and smooth out wrinkle lines. Administering Botox for aesthetic purposes is a bit of an art form. As providers develop skill and proficiency in Botox use, they'll learn better techniques and recognize the need for dosage adjustments for individual faces. They'll also need a deep understanding of the muscles of the face. For instance, injection into the frontalis muscle works to freeze the forehead and remove horizontal wrinkle lines. Experienced providers will recognize that an injection may need to be low enough and involve the lateral brow, so that the lateral portion of the brow won't lift while the rest descends, creating what's called Mephisto's sign, also known as Spock's sign, after the beloved Star Trek character. However, too low of injections can cause brow ptosis, or brow droop, from paralyzing the lower muscles of the eyebrow. Even though the patient may not have wrinkles in the glabella area, these muscles also affect the eyebrow, and injections may need to be included there to balance the work that's been done on the forehead. Finding the perfect balance between the two on a particular patient is what sets experienced professionals apart from beginners. Anyone wanting to deliver Botox injections should attend proper training to master these techniques, learn the anatomy and physiology of the face, and build experience slowly. Other common areas of injection for aesthetics include the orbicularis oculi muscle, which runs around the eyebrows and just above the bridge of the nose. Injecting into this muscle will allow you to lift the eyebrows for aesthetics to correct lazy eyes or droopy lids called ptosis, as well as remove crow's feet wrinkles. Injecting the nasalis will prevent and remove what are known as bunny lines, wrinkles that bunch in the nose. Typically, injections are very shallow and hit high up on the bridge of the nose and on each side of the nose. The orbicularis oris muscle runs around the lips, and injections here are commonly called a lip flip treatment. These injections will help pucker the mouth, exposing more of the upper lip and giving a fuller look to the lips. This same technique is used to eliminate smoker's lines, the small vertical lines surrounding the mouth and along the upper lip. Injections are done just outside the vermilion border, the edge of the lips where the lip tissue transitions to normal skin. Typically 2 to 4 injections in the top lip, outside of the philtrum, between the edge of the nose and the corner of the mouth, and 2 injections in the lower lip for the same effect on the bottom. Injection of the depressor anguli oris, the muscle that starts at the mandible and inserts into the corners of the mouth, can smooth out prominent wrinkles down the sides of the mouth, called marionette lines. There are several techniques for injecting this muscle, but take caution, as involvement of the accessory muscles can droop the mouth and interfere with facial expression, speaking, and eating. The mentalis muscle of the chin can be injected low and medially just to the side of the midline chin to eliminate indentations and wrinkles called pebble chin. You must be careful not to hit the depressor labii inferioris, as it can cause drooping of the mouth. As you can see, the lower we inject on the face, the higher the risk of affecting muscles we rely on for facial expression, smile, speaking, and eating. Master the upper face before attempting lower face injections, and do so with the proper supervision, education, and training. Everybody is unique and may respond differently to Botox treatment and doses, but have no fear. Botox effects are temporary, wearing off around 3 months, and asymmetry can be adjusted with touch-up appointments and careful administration. The use of Botulism Toxin A isn't only for correcting facial symmetry and achieving aesthetic desires. It is also proven useful in the treatment of medical conditions. Migraines particularly are often treated with small Botox injections along the scalp, relieving many patients of debilitating pain from migraine headaches. Hyperhidrosis, or excessive sweating, is a frustrating condition that many suffer from. Botox injections into the armpits can help prevent excessive sweating and assist individuals with staying dry and comfortable. Vision issues caused by lazy eyes, natural ptosis, or neural effects can be corrected by lifting the eyelids. Even urologists can employ the use of Botox by injecting the bladder to treat urge incontinence. So if you think you may be interested in Botox treatments, you'll probably have some questions on just how a visit to a health spa or clinic for this treatment would look. Let's take you through it step by step. First, providers should ask patients pertinent questions regarding their desire or need for the procedure. This gives the provider and patient the opportunity to communicate and come to an understanding on the goals for the treatment. Next, pre-treatment forms should be filled out with the patient's medical information, like allergies, medical history, prior treatments, and so on. It's important that providers know this information so that they can deliver safe and individualized care. The patient will fill out what is called an informed consent form during this process, and have an opportunity to ask their provider any questions. Informed consent forms are signed forms granting permission for the provider to conduct the treatment, ensuring that the patient is aware of possible risks and side effects. Botox is generally safe, but with any medical procedure, there are risks. Specific things that are rare but can happen with Botox are bleeding and bruising of injection sites, damage to deeper structures such as nerves and blood vessels, allergic reactions, infections, scarring, bumps, headaches, respiratory problems, localized weakness, and ptosis of the eyelids. Talking with a provider and asking pertinent questions gives the patient an opportunity to discuss concerns and weigh the risks. The provider will also walk the patient through the steps of the procedure to ensure they understand what will be completed. After the paperwork is set, providers will complete the procedure. Botox is a short treatment and will first involve prepping the facial sites with a face wipe and alcohol pad to cleanse the injection area. Sometimes a skin pen will be used to mark the region for injection, though injection should always be done outside of these marks, not directly through. Small injections are then made with a tiny 31 to 32 gauge needle until the procedure is completed. Botox will spread or trickle down to the areas just below the injection site, which is why injections are typically done higher, and dosage adjustments can be made to increase or decrease the desired spread. Once the procedure is complete, the provider will discuss post-care instructions with the client. For instance, for best results, it's best to not lay down for about 4 hours after injection, as this can cause the Botox to spread in undesired ways. The same goes for bouncing movements of the face like jumping up and down, and any rubbing of the area. Treatments can last up to around 3 months, and touch-up appointments can occur around 3 weeks after the initial procedure to assist with any asymmetry. As you can see, Botox is a safe, effective, and profitable procedure for many health and wellness clinics to add to their repertoire. If you're ready to take the next steps, contact Guardian MD to make sure you're doing it compliantly, legally, and safely, with friendly medical directors and educational resources to assist in your business growth. And don't forget to like, subscribe, and follow. See you next time.